Hello, it's Mark Dennykamp from Springdale Clinic again, just to share with you some of the problems you can develop with varicose veins. For most people, they can be totally asymptomatic. They don't get any problems from them, they just don't like the look of them. And that's fair enough, that's a problem obviously for many people. But beyond that, some people will get aching, some people get cramps, and they may or may not be related. Cramps may or may not be related to varicose veins, especially those that occur in the feet and at night, often related to varicose veins. Then there are other people who get restless legs. Whenever they're sitting for long periods or standing for long periods, they keep having to move their legs, and it seems to be connected with a bit of congestion in the legs, where you get a bit of a build-up of fluid because of the reverse flow from the varicose veins. Other people will get itching, which sounds like nothing really. It doesn't sound like a serious problem, but itching is the best indicator that if you don't do something about them, you're going to get more serious problems later on. And it probably is due to the fact the skin is becoming dry and not as well nourished, because the drainage of the blood, the waste blood away from the veins is not occurring, and therefore people get that sort of dryness and itching. And the next thing that'll happen after that is often a bit of eczema, varicose eczema, which will clear up with some cream and so on, but it comes back straight away afterwards as soon as you stop using the cream, because that skin isn't well nourished. And then the other problem that can occur nastily after this sort of, when you get that sort of difficulty with the skin circulation, is you get a minor injury and it doesn't heal, and it tends to, instead of healing, actually get bigger and bigger, and so people end up with ulcers, which is, those that have been aware of people that have had varicose veins are very aware, is one of those awful situations where, unless it's treated really well, it takes forever to heal. And in fact, about the only way that you're going to get long-term healing is to fix the varicose veins. Beyond that, over time, because there's back pressure on the tissues in the skin, people will develop thickening and scarring in the skin. It can be an acute situation where they get a sudden red, angry, tender area, which then settles, or it can be a slow change where you get changes in the colour to a browny colour, then a thickening, which is just due to scar tissue occurring under the skin. And then beyond that, sometimes people will get varicose veins that they'll knock and they'll bleed very easily, and because there's no control of that backflow, people can bleed quite seriously from them, just because there's nothing to stop that blood pouring out. If you just simply elevate the leg or put some local pressure on it, it'll stop immediately, it'll stop completely. But the problem is people often panic, and running around, they'll only bleed some more. Occasionally, some people will get a little local clot within the varicose veins, usually a surface clot, so you get this area that becomes red and inflamed, and that can be quite tender, and that can just be because the veins are such a knotty, tortuous segment that the blood doesn't flow freely, and you get all the cells accumulating in that area and clotting together. And there seems to be, maybe there's a slight risk of an increased clot from varicose veins occurring on the deep veins, which is the one people really worry about, which can break off and then pass on to the lungs or to the heart and cause serious problems. There may be a doubling the risk of that occurring with varicose veins, but the other things that tend to occur and create more problem with veins are people that have got serious clotting problems, where they have an increased tendency to clot, and they may have 100 times the risk of the normal person out in the community of developing clots. Beyond that, the other problem is that once you've got varicose veins, it tends to breed others. So the longer you leave them untreated, the more veins you're going to get with time. So treating them early in many ways is the best option, but then again, sometimes you'll find insurance companies aren't interested in treating them when they're very minor and they're not causing problems. There are people out there who have got significant symptoms from their varicose veins, and they may not look to be that great on the surface. In fact, quite a few people who don't have any symptoms can have significant varicose veins, and then sometimes that'll be because and other people that don't have much have tremendous symptoms, and that can be because there's a lot going on underneath that you can't see on the surface. A bit like the tip of an iceberg, you're only seeing a bit of the problem. But the other thing that does happen in those people who have quite bad varicose veins, but say that doesn't worry them at all, is that they'll actually come back after they've been treated and say, well, actually, they feel a different person, they've got a lot more energy, they don't have these tired, heavy legs that they had, which they put down to age and so on. And so there's a lot of things that go on with varicose veins, which, although they're not life-threatening in most cases, are a real nuisance and can make a big difference when they're fixed. We'll go on and talk further about varicose veins in further videos, but for now this is Mark Denny-Camp at Springdale Clinic signing off. And if you'd like to leave a comment below or just ask some further questions that we can go over for you for your information, please do below. Look forward to seeing you again. Bye.